Pubs and bars in northern England are living on borrowed time. In Liverpool, those not serving food will be forced to close from Wednesday night, the city falling under the highest risk category of a new three-tier system of COVID-19 restrictions announced by the Prime Minister.
In recent months, we have worked with local leaders to counter local spikes with targeted restrictions. But this local approach has inevitably produced different sets of rules in different parts of the country that are now complex to understand and to enforce.
Infection rates are soaring in parts of the north, and other cities like Manchester, Leeds and Newcastle in Tier 2 know they could be next. But critics question the science behind bans on the hospitality sector, already struggling to survive.
We've seen what's happened over the last 4 weeks or so, this big upsurge, and it coincides, I don't think coincidentally, with the return of students, with the return of the children to school. It has yet to be shown, when the data is not available and is not being presented, where this alleged sudden increase within hospitality is coming. I think it's very convenient science.
And there are questions about the effectiveness of these measures, including travel restrictions and bans on household mixing, with evidence that the national test and trace system has failed to trace contacts effectively and to enforce isolation. The government has promised to confer more power on local authorities, who say they can do the job better. Here in Newcastle, there's relief that they've escaped Tier 3 for now, but there's also a lingering worry that the rules seem to overlook another big threat, the enormous rate of infection among students. Universities in the north, with their crowded halls of residence, have been huge drivers of infection. Rates are said to be up to 7 times higher than surrounding areas after students were encouraged to return to campus last month.
There's plenty of blame to go around here, and from the university's point of view, I think they were told we're going to have a world-class test and trace facility, we're going to have this, we're going to have that, and so forth. And had we actually had those things that we were told we would in May and June and so forth, then the decisions that they made might have worked out fine.
Like so much to do with COVID-19, if only.